Hello, my name is Kirsten D. Chavez, and this is the mini mental exam for assessment. This is Ryan Staub. He's going to be helping me today for this recording. I chose to do an assessment of a mini mental exam, which is normally a 30 point questionnaire with consist of 30 questions on a bigger scale. On a smaller scale basis, I'm using 11 questions to ask Ryan to determine his current cognitive function. Usually in clinical practice, when you encounter a patient for the first time to perform a mini mental, you would use such an exam as the one I'm about to display. Are you ready, Ryan?
Yes.
Okay. So I am going to be scoring out of 30 as I ask questions. In true clinical practice, we would not, usually would not have a pen and paper to do this, but for grading sake, I'm going to be marking Ryan's score as we go along. Okay, Ryan, so I just have a few questions for you. They're pretty straightforward and simple. If you have any other questions during, you can ask me, but just answer the questions as best as you can. Are you ready?
Yep.
Okay, what is the year?
2018.
What season are we in?
Spring.
Can you tell us today's date?
Today's date is 15th
Okay, of what month?
June.
Okay.
Okay.
It's okay. Sorry for the profanity. We're going to continue. But he scored well on that. He hit five of the five marks on that, so he gets a 5-point numeral scale. Okay, the next question is, where are we right now?
Nutley.
Okay. Do you know what state we're in?
New Jersey.
Country?
USA.
Okay, great. And do you know what apartment number we're in?
7A.
Good. So Ryan scored a 5 on this one as well. If we were in true clinical practice, he would say what hospital, what floor, what room, and it would attribute to the same score. Okay, so I'm going to name 3 objects. You're going to have to repeat them after me, and afterwards at the end, I'm going to ask you to repeat these 3 same objects, okay?
Sure.
Mirror,
Mirror.
lamp,
Lamp.
bike.
Bike.
Okay, mirror, lamp. Okay. Again,
Mirror, lamp, bike.
and another time.
Mirror, lamp, bike.
So for this mini mental, it's telling me for cognitive repetitiveness and memory, Ryan scored a 3 out of that, and towards the end of the exam, I would ask him again if he remembers the 3 objects that I listed. So we're gonna move forward. I'm gonna ask you to spell cat backwards. Can you do that for me?
TAC.
Good, and one more time, what's cat backwards?
TAC. Tack.
Good, good. So Ryan scores a 5 on this mini mental question. So I'm going to point to 2 objects and you're going to tell me what they are, okay?
Sure. Pen.
Okay, and
Hat.
okay, good job. So that's another cognitive function factor that would be taken into mini mental, visual, and memory. So he would score a 3 on this as well. So earlier I asked you to repeat, name 3 objects. Can you repeat them to me?
Mirror, lamp, bike.
Good job. So Ryan would also score another 5 on that. And at times during a mini mental exam, you would ask the person to repeat a phrase. So this phrase that this mini mental that I researched asked the client or patient to repeat, no if, ands, or buts. Can you repeat that phrase?
No if, ands, or buts.
Good job. So Ryan also scored a 1 on that. And we have a few more questions here. I'm going to write an instruction on this piece of paper, and you're going to tell me what it says, and you're going to perform that action, okay?
Sure.
Okay. Okay, can you just repeat that for me?
Stick your tongue out.
Okay, and can you perform that action? Good job. So this would score a 1 on this mini mental exam. Okay. So the final question on this mini mental exam with time would actually ask the examiner to draw an object, and the client or patient would have to identically redraw the object without tracing. So I'm gonna do that now, and I'll show you the object straight. No cheating. So I'll show you the object. Okay, and Ryan, if I can ask you to view this object,
Yep.
can you please redraw without tracing? It's a valid attempt, but very good job. It looks pretty identical, actually. So he redrew the smiley face. The mini mental exam here states to draw things with angles, but I believe that cognitive function can also include pictures, so I decided to draw a smiley face. Okay, so Ryan scored a 1 on that. So now we're just gonna add up the points that he scored. Good job. You're welcome. So 10, 15, 20, 23, 26, 27, 28, 29. So Ryan scored a 29, which is great because the total exam consists of 30 points. The interpretation for these scores, as listed here on the mini mental exam, says that less than 24 is abnormal. Less than 21 is an increased odds of dementia. Greater than 25 is decreased odds of dementia per range. Excuse me. Education-wise, a normal 8th grade education would consult as 21 score. Abnormal for high school is less than 23. Abnormal for college is less than 24. And Ryan here is a high school and college graduate, right?
Yes.
Okay. So severity, it goes by cognitive impairment severity. 24 to 30 is the higher end of the score, which says that there's no cognitive impairment. 18 to 23 states that there's mild cognitive impairment there. And if the individual scores from 0 to 17, there's severe cognitive impairment. Now, I was able to sit down with Ryan and do this, but on an easier level, especially in an emergency department, if you were to meet a person for the first time, i.e. a patient, I would utilize almost only 3 of these questions and score them per AAO times 3, and I guess this is per orientation. So you would ask them, are they alert? Are they awake? Are they oriented, and by what factors? So 3 factors would be person, place, and time, which consists of the 3 questions that I first asked Ryan there. So Ryan, if I were your nurse walking into the room for the first time, I would actually ask you, can you tell me your full name?
Yes.
What is your full name?
Ryan Michael Stott.
Okay, do you know where we are right now?
In your apartment.
Okay, good. And do you know what time it is, or what day it is today?
Today is Tuesday.
What month and what year?
May.
Yes.
2018.
Great. So Ryan answered those 3 prompts correctly, and it would result as being AAO times 3, or alert, awake, oriented times 3. So that is my mini mental exam with Ryan here. Thank you very much.
You're welcome.
And that's it. Thank you.